Hi, Dr. Gullberg here, continuing our internal medicine lecture series. Today we're going to talk about acne. We see a lot of acne, obviously, in the outpatient setting. Let's kind of review some of the key points. Number one, we know acne is the clogging of sebaceous follicles from keratin and sebum. And believe it or not, 50 million Americans are affected by this problem. Androgen, obviously, is the stimulator, exacerbates the condition through DHEA and through insulin-like growth factor, which obviously starts increasing at the time of puberty. This is generally a genetic condition, can be inherited, obviously. Comedones are whiteheads and blackheads, obviously are graded between mild and cystic and very severe, according to our dermatologists. These lesions are often infected with Propionibacterium species or Staph epi, and high glycemic diets and milk consumption seems to make acne worse. So what are kind of the medicinal treatments that we've been using acne, against this problem for years? Number one is the benzoyl peroxides, which range between 2.5 and 10%. These agents have been used for since about the 1920s. They've combined benzoyl peroxide agents with retin-A agents. We've got Epiduo, and we'll talk a little more about retin-A products later. The second big area of effectiveness is antibiotics, using oral or topical. Erythromycin, clindamycin, combining clindamycin with benzoyl peroxide, such as in Duac, or clindamycin with retin-A products, such as in Ziana. Other antibiotics effective are tetracycline agents, such as doxycycline or the minocycline. Certainly have to watch for side effect profiles for both of those agents. The third area, of course, is in hormonal manipulation, especially for females. There's a synthetic progesterone agent called drospirenone, which they combine with estrogen in a product called Yasmin or Acela. Drospirenone is an analog to spironolactone, which of course is used in facial rosacea, especially effective in women. Fourth big area is the topical retinoids, such as retin-A, the adapalene, which is Differin, and then of course there's over-the-counter retinol products as well, but they're more gentle. All of these retinoids are related to vitamin A, and they normalize the follicle cell life cycle. Oral Accutane is very effective, dries the skin out significantly, used usually for 4 to 6 months, but there are some issues with side effects that are very serious, teratogenic, and possibly changing moods severely. Anti-inflammatory agents can be effective, as can vitamin B3, as can non-steroidal anti-inflammatories, as can even mandelic acid, which is found in these chemical face peels. So a lot of different treatments for acne. I want you to be aware of the different groups of agents that we utilize. We can all benefit from having more knowledge of treating this awful problem. Thanks, Dr. Gullberg, signing off.